The NHS is facing significant challenges over funding, even though in the recent settlement we were perceived to do well. But of course we have an ageing population, we are having advances in medicine, so cost is going up the whole time. And we know without that, in North West London, we need to reduce our costs by £1 billion over the next 5 years. What the HIAC will do is look at ways of helping the QUIP agenda, so making sure our performance is better, partly by delivering healthcare in more appropriate settings, not having repeat admissions or outpatient appointments, but also getting innovation so that we can help people be less dependent on our services.
I think the HIAC, because of the kind of partnership and collaboration that it is really well placed to support staff at all levels and in all professions in North West London to help lead the strategy and service changes that are absolutely essential, even more essential in times of financial and policy pressure. So I think the HIAC, with that kind of ethos, will be able to give added value, be able to support in very practical ways groups of staff who want to improve the patient pathway, the patient experience, the quality of the service, simply by putting in professional consultancy or administrative resources.
I think what has been impressive already with the meetings that we've had around the HIAC has been the level of engagement, and it has seemed to stimulate the interest of all people involved in the process and the pathway of patients, from managers, from primary care, from the nursing fraternity, from the medical fraternity. And it is important that all these elements come together in the one room to discuss the patient pathway and the ways of optimal delivery.
I'm particularly interested in working with HIAC because I'm an academic working in the health service, very interested in modernising practice. And within cardiology, I was particularly interested in trying to get the expertise out of the specialist hospitals nearer to where patients live so they could benefit from new developments. And we've chosen two areas for the North West London HIAC, and that's telemonitoring of patients with heart failure and cardiac rehabilitation.
What telemonitoring does is remotely keep an eye on a patient, monitor that patient's symptoms, which is a much better way of anticipating or picking up on when a patient is starting to deteriorate. The benefits, reduction in inpatient emergency admissions to hospitals of about 40%.
Now, my team has a lot of experience in telemonitoring, doing randomised trials in West London in the past 10 years or so, but putting it into routine practice requires people to change their attitude to using technology, to know how to best use the technology, and also share best practice across the patch. And all of that takes organisation, and that's where the HIAC has been particularly helpful in coordinating those educational initiatives, working also with the higher education authorities across North West London, for example, Imperial College and other universities.
We want to get good ideas to the patients quicker and get more people adopting good ideas. How we're going to do that is we want to make things happen. We want to find out what barriers are stopping service implementing good ideas and come up with some really practical solutions. Now that can be as simple as funding a technician to install some telemonitoring equipment, or, as in the case of our cardiac telemonitoring project, we're actually funding the development of a specific course that's going to support nurses develop skills, knowledge and expertise in managing patients with heart failure.
The course that we're developing is going to be both a face-to-face course with lectures, but will also be a remote course as well, providing some distance learning, which will also be online lectures and also some interactive case discussions.
What that course is going to enable is new organisations to feel that they can take on telemonitoring because their nurses are going to be prepared and have the skills to do it.
So far it's certainly been going well. We've had some issues in the run-up to initial launch around making sure that we've had the appropriate governance in place and that we've had patients' consent to take part. Now that we've got the first set of units on the ground, they're starting to pay dividends in actually taking the readings, taking the other various measurements. But we are working with our matrons at the moment to make sure that the parameters are right for individuals.
On a personal level, I found it professionally developing because I haven't actually been involved in a scheme where I could start from day one right through, and we're now got the installations done and we're doing the monitoring, and I'm looking forward to doing the evaluation of the whole scheme.
When we actually audit this project, what we would expect to happen is to have a reduction of hospital admissions, and for the patients to be able to empower themselves, to be able to actually know their clinical conditions earlier rather than having deterioration of conditions.
I've had the monitoring now for 1 week. Wonderful. Changed my life around since I've had all these gadgets and help at home, you know. My main concern is being able to keep out of hospital.
The wider bit, I think, is the enthusiasm and the engagement, and on the ground, our staff in all of our organisations feeling that innovation and quality, productivity and performance are all interlinked, and that they can do it, and that they have a key role in making that happen, all in the interest of getting patient care and health care better in our populations.